Welcome back. With me right now is Dr. Cheryl Alvarez, and she is the Director of Clinical Research and Education. She is with the Alzheimer's Family Center. What we're talking about today is their work with Mission Hospital, the Mind and Memory Center. Nice to meet you.
Nice to meet you.
Yeah, that's a great hospital up the road there.
Yes, Mission Hospital in Mission Viejo.
Yeah, so tell me about this program, because you know, obviously you look at this and we're talking about memory loss and all, but also mental health issues, depression, anxiety, or PTSD, right?
Yes.
So that encompasses a lot.
All of the above. So the Mind and Memory Center is a program that's at Mission Hospital that's intended to treat individuals who are experiencing or think they're experiencing some memory loss, but also have a psychological issue like depression, anxiety, or PTSD.
Okay. What helps you as a doctor and the way you're trained in determining, you know, you might have people come in that just you know, feel depressed or feel they may not know or know how to explain it.
Yes.
How do you go about that? Because I think that would be very difficult.
You know, the signs and symptoms of depression are really well documented, and our ability to treat it is also really successful.
Yeah.
And so I always think anytime someone's managing or trying to manage symptoms of depression and it's not really leading to the kind of quality of life that they want, getting treatment is such a critical step to take. And it's especially critical for people who have memory issues. Yeah. Because it can progress those diseases, and that's the last thing we want to happen. So treating a psychological disorder can actually play a significant role in maintaining their cognitive skills for a longer period of time.
People that may have some sort of a mental health issue or depression, is that, can that lead to more memory loss or Alzheimer's in the long run? Are they connected? Or can be, I should say, can they be connected?
So there is a relationship. The research shows us that there's a relationship that actually has to do with their risk. Okay. So people who have depression in particular earlier in life do have a higher risk of developing Alzheimer's disease or another type of dementia later in life. Okay. So really treating it at any point is critical. Our program is focusing on the mature adult population that might be experiencing both. And we know that helping one is really likely to help the other. So there's a dual purpose.
Socialization, tell me how important that is. And obviously, I think for people who are beginning to get some memory loss, you know, it stimulates that. But on the other hand, sometimes people who have depression feel even more isolated in a socialized setting, right? Absolutely,
a vicious cycle.
Yeah,
They feel depressed, so they don't want to socialize. They don't socialize, they feel more depressed. Socialization is profoundly important. Yeah. It absolutely is a huge part of managing depression, and actually benefits the brain and your brain health. The brain really likes it when we engage in socialization because it's complicated, and when we're speaking to another person, we're listening and talking and maybe even learning. And so it's really good for us overall, both from a mood perspective and from just a long, healthy brain aging perspective as well.
And I see you do both individualized sessions and therapies, but also, again, the group, and also learning different skills. What are some of the skills that you teach?
So the program is an intensive outpatient program. So people come for a half of a day. They're there for about 4 hours a day, and they may attend several groups during that time or have individual sessions, which are really valuable. And they may learn things like coping skills, learning how to cope with changes and things that are happening in their lives, and managing them better.
I think that's hard for a lot of people, even
it is.
For a lot of us, regardless of your age.
Throughout life, we're learning coping skills. They also learn about communication strategies. They might learn about identifying changes and how to deal with them. So there's so many topics that are really relevant to this population. Sometimes we're focusing on grief and loss, or anxiety as a strategy to just have overall longer, better quality of life.
And there could be multiple issues as well. There could be dealing with a loss. There could be some depression that even before the loss, it was just a part of their life, and anxiety, right?
Absolutely, absolutely. All relevant issues.
Yeah, and going through that, multi-step process? Is this something that once they start coming to these group sessions, something that is ongoing for several months, years, or?
It really depends on what each individual needs. So we would cater to the individual plan and decide patient by patient what really is appropriate for them. So some patients will come to this group for a few months just to help resolve an issue like anxiety, or some people may be there longer. So it really depends on the person and what their needs are.
How do you get the family involved, if there is hopefully family around? Family and friends, I would say, as well.
It's always preferable to have the family involved. The family is oftentimes the people who are noticing that there's a change, or noticing that something's different, or that there might be a problem. And so oftentimes the family can be an advocate to help this person get the help that they need, or just give them the benefit of being enrolled in a program that's going to hopefully improve their mood and keep their memory intact for as long as possible. So we definitely welcome the family to be involved and to come and see us and be a part of their loved one's care.
How do you get started with this, or how does the person get started? Is it first noticed, if it's first noticed by the family or maybe their physician, how do they go from that step to getting in touch with this program?
Really, the step is to make a phone call, and it's to call the program and to set up an appointment. And that appointment, they'll meet with our outreach manager, who will do an assessment, teach them about the program, let them know what's available, and then they'll come in and meet the team, and we'll make a determination about whether or not this is the right program for them. There are actually very few resources available, so this is very exciting to be one of the resources that's available to help people who have both a memory issue and a psychological issue.
Is this covered by insurances and by Medicare?
It is. It is covered by Medicare and by many commercial insurances, and we also include transportation. So the family doesn't have to bring them, or the person doesn't have to drive themselves if they don't prefer to. We'll include door-to-door transportation.
That's nice. And it is done up at Mission?
We are at Mission Hospital, correct.
All right, which is just right up the road, so it's not far at all.
Yes.
And great program, and boy, it encompasses a lot.
It's amazing. It's the first one of its kind in the nation.
Yeah, very good. And I can see the benefit of it, really. And both the individualized and the groups are so important. And then, you know, kind of getting with them one-on-one and figuring out, you know, what's the best path to take. So I would imagine with different things, it's, you know, it can be varied, right?
Absolutely. And it's really critical to take steps. So if someone is experiencing changes, whether it's memory loss or it's depression or it's anxiety, or it's something that really interferes with them living the life that they want to live, having the relationships they want to, it's really important to get treatment and to take a step towards resolving it, which we can help with.
Very good. Nice to meet you, Doctor.
Very nice.
And the website is mission4health.com. That is the numeral 4, mission4health.com/mind and memory. There you go. We'll see you again.
Thank you.
We'll be back.